So one of the hot button subjects here in America is health insurance and trying to make it so that way it's accessible to everybody. And there have been a lot of different efforts made to make that possible. One of the biggest setbacks, even with these great services that are provided, is that you have to get to the services. And while that might be great for able-bodied patients, people who have issues with getting rides to their appointments, finding different modes of transportation to show up, they're kind of out of luck sometimes. And one of the biggest things that can be prohibitive is we're talking about people who have chronic conditions or the elderly or, you name it. There's issues. Just lack of a vehicle, for one, can be a big problem. And we're starting to see this new trend develop within the healthcare industry with using ride-hailing services or ride-sharing services such as Uber and Lyft. Now, we've seen it happen already with MedStar Health. It's a nonprofit healthcare system with hospitals in Maryland, and they set up a partnership with Uber back in January. Now, back in February of 2015, it's almost 2 years ago, there was an incident with the National MedTrans Network where they had an elderly woman in New York waiting for a contracted provider. Now, somebody who has a contract set up to provide these rides for these patients to get there, she was left waiting in the freezing weather for 30 minutes. Now, that can be a significantly dangerous situation, and even the CEO, Andrew Winokur, of the National MedTrans Network agreed that was almost a really dangerous situation. Well, with Lyft, which is who they've now contracted, or I don't know if it's necessarily contracting, but it's setting something up to be able to have some sort of a plan to get their patients to and from. Now it's more reliable. With Uber and Lyft and other ride-sharing services like that, these are people who, they're not working for a company. They're working for themselves. Now, the medium for them doing this is Uber and Lyft, but that's just how they get their money. They have stake in this. They need to be able to provide these rides to get the money. So they're more reliable. You're not going to have people who were sitting without somebody to pick them up. So it's really interesting what's happening right now. Great stuff. Check it out. There's more information on khn.org/news. And you can find more there about the medical providers try Uber and Lyft for patients with few transportation options.